My name is Salum Mshamu. I'm a public health researcher and director of CSK Research Organization based in Mtwara, southeast of Tanzania. In the Star Homes project, I'm the on-site co-principal investigator, and I've been involved with this project since the beginning. Initially, we wanted to understand how building elements, which have been successfully employed in Southeast Asia to prevent mosquitoes from entering and cooling the house, could be integrated in a more sustainable house design in rural northeastern Tanzania to decrease mosquito density and regulate the indoor climate. Now we want to understand whether this novel design house can actually minimize the risk of transmission of diseases such as malaria, respiratory tract infection, and diarrhea diseases in a hot and humid environment of Sub-Saharan Africa. According to UN population projections, by 2030, 1 in 5 people will live in Africa. It is also projected that the population of Africa, which is currently at 1.3 billion people, will double by 2050. As the population increases, demand for housing will as well increase. It is estimated that there will be a need for 400 million new houses in Sub-Saharan Africa alone. In Tanzania, it is estimated that 3 million units with an annual increase of 200 units will be needed according to the Shelter Freak, a Pan-African finance institution. This necessitates the construction of millions of new homes and replacement of existing houses over time. According to United Nations, now 55% of the world's population lives in urban areas. This is expected to increase to 68% by 2050. This is contributed by the gradual shift of the population from rural to urban areas searching for economic opportunities. Although this is the case, it is still predicted that large population growth will also happen in the rural areas. A typical rural house in Tanzania is usually a single-story building made out of wooden sticks and heavy muddy walls with very small windows or no windows at all. Earth floor and thatched roof, the eaves are usually open. When the family gets income and wants to improve their house, they usually build brick walls houses, which are also heavy. They put cement floor and iron roof, usually with small unscreened windows. Usually they also have a poor water supply system and sanitation system. The houses described here predispose the occupants to preventable illnesses. Open eaves and ground level provide easy access to mosquitoes, which can infect the occupants with malaria and other vector-borne diseases. Heavy walls with high thermal mass absorb a lot of heat during the day and radiate heat during the night. With the house having small or no windows, makes it unbearable hot to sleep under the bed net, hence reduce the use of bed nets. Cooking indoor in a house like this, with very little ventilation, causes occupants to inhale smoke and then lead to respiratory tract infections. Poor water supply and sanitation system predispose the occupants to enteric infections. If this continues, there will be a huge health and environmental consequences considering the rapid population growth, especially in Sub-Saharan Africa.